Ladies and gentlemen, thank you for standing by and welcome to the LA County COVID-19 update call. At this time, all lines are in a listen-only mode. Later, we will have a question and answer session. If you wish to ask a question over the call, please press 1, then 0. I'd now like to turn the conference over to LA County Supervisor Kathryn Barger. Please go ahead.
Thank you. Good afternoon, and thank you for joining us for our daily briefing. I'm Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Dr. Barbara Ferrer and Dr. Christina Galli are here to provide their updates on the county's health response to the COVID-19 crisis. We are also joined by Antonia Jimenez, Director of Department of Public Social Services. There are so many residents throughout the county who need help to get through these tough times now more than ever. Our Department of Public Social Services is here to help. They are still working in full force, whether you're an existing client who relies on CalFresh, CalWorks, or General Relief, or you are finding yourself in need of social services for the first time because of the COVID-19. DPSS is still fully operational with eligibility workers and staff who are working around the clock to ensure both new and existing clients receive the help that they need. Antonia will speak in more detail about their services and how residents can access these programs. I would also like to take a moment to thank all of our dedicated county employees, including those at the Department of Public Social Services. Even though they are not on the front lines of healthcare or our first responders, they are working every day to support the needs of the Los Angeles County residents. Let me also take a moment to reaffirm my deep appreciation to our law enforcement community. I need to dispel the rumors circulating that our sheriff's deputies may not be fully compensated when quarantined. Please know that the Board of Supervisors and our CEO, Sachi Hamai, will ensure you continue to get paid as you deserved to get paid. I support all of you and thank you wholeheartedly for your constant dedication and protection to our communities. With that, I would now like to turn it over to the Chair Pro Tem, Supervisor Hilda Solis. Thank you.
Thank you, Chairwoman Kathryn Barger, and it's a pleasure to be here this afternoon with you. I'm County Board of Supervisor Hilda Solis, representing the 1st District, and I also want to take this time to thank Dr. Barbara Ferrer, Director of our Department of Public Health, Dr. Christina Galli, Director of Department of Health Services, and Antonia Jimenez, our Director of Department of Public Social Services. And I want to thank also the county family, our departments, our staff that have been working tirelessly to combat the coronavirus epidemic. Combating this virus, as you know, has taken a tremendous toll on our economy and on our communities. Last week, as you know, unemployment claims skyrocketed with more than 878,000 Californians filing for unemployment. And that translates to approximately 250,000, a 250,000 right here in Los Angeles County, impacting our residents and therefore the need to file for unemployment insurance just last week. Our families, as you know, are struggling, especially those who were already living paycheck to paycheck. And if you recently lost your job, we'd ask you to please visit edd.ca.gov/unemployment or call 1-800-300-5616 to file for unemployment insurance. With the recent passage of the $2 trillion federal CARES Act, many Americans will receive a stimulus check to help mitigate the losses suffered during the COVID-19 crisis. For taxpayers who have provided bank account information to the IRS, you should see a direct deposit by April 17th. Those opting to receive paper checks may face a delay up to 5 months, but it is my expectation that the federal government will work to resolve those issues expeditiously. For more information about those checks and to get other support from the IRS, please go to irs.gov/coronavirus or contact your federal representative. I want to touch on small business assistance. With our families in mind, LA County and our partners are doing everything we can to support our workers, our small businesses, and our communities throughout this crisis. Yesterday, as you know, Governor Newsom announced that LA County will be receiving state funding to assist local workers and businesses. Of the $2 million allocated to LA County, about $500,000 will be used to provide grants to eligible LA County businesses that can demonstrate significant economic hardship as a result of the COVID-19 in order to help them retain their workers and obviously remain in business. Our county team is also working to launch this program as soon as possible and will provide more information to our small business community. We've also launched here at the county a project called Business and Worker Disaster Help Center, the county's central portal for the COVID-19 relief for businesses and workers. The Help Center provides support in multiple languages, including Spanish, Korean, Mandarin, Chinese, and Armenian. And in its first week alone, the Help Center fielded more than 1,000 calls from small business owners and workers seeking assistance. We continue to work to provide small businesses with the resources that they desperately need to keep operating. If you need emergency access to keep your business afloat, the Help Center can assist you with your U.S. Small Business Administration loan application and connect you also with state funding opportunities. Those resources can be found at lacountyhelpcenter.org or by calling 833-238-4450. For more specific support, the Los Angeles County Economic Development Corporation also provides technical assistance to businesses across the county through layoff aversion. This organization helps companies create a blueprint to avoid laying off workers, which may include resources such as connections to capital and information on tax credits. For more information, you can go to laedc.org or call 213-236-4839 or 8884/LAEDC/1. Businesses can also receive technical assistance, including strategies to avoid future layoffs through our American Job Centers of California. They also offer critical information about available jobs for workers that are being displaced or impacted due to the coronavirus. For more information, please call our county's workforce development team at 213-810-1641. And one thing I'd like to mention also with respect to food security. We know that many times it's hard for many in our families to access meals, particularly at this challenging time. And it impacts low-income families, including children and seniors. And as a part of our early nutrition program, the county has made the home-delivered meals program designed specifically for older adults and homebound individuals available. We would like you to call 1-800-510-2020 for more information. And for students who normally participate in their school's lunch program, families can call 211 to learn about locations where meals will be available for pickup. Our director of the Department of Social Services will share information about the CalFresh benefits and other critical safety net programs that the county has to offer. In conclusion, the Los Angeles County is here to ensure that all of your needs are met, and we will do our best during this crisis, but we must work together. So again, pay attention, stay home, stay safe, and although we're practicing physical distancing, please stay connected with your communities and with your loved ones. Thank you very much. At this time, I'd like to introduce Dr. Barbara Ferrer, our Director of Public Health.
Good afternoon, everyone. Thank you so much, Supervisor Solis and Supervisor Barger, and all of our colleagues for their tremendous leadership during this very difficult time that we're facing together. I want to quickly update you on the current status, starting today with some of the sobering statistics around both the numbers around the world and also the numbers across our country here in the United States. Globally, there are now over 1 million cases of COVID-19, and the mortality rate across the world stands at a staggering 5%. In the United States, we have 250,000 people that are infected with COVID-19. It's about a quarter of the global cases in the world, and our mortality rate in the United States is at 2.5%. In California, there are almost 11,000 confirmed cases, and the mortality rate here is 2.3%. And in LA County today, I'm going to be reporting that our case count is up to 4,566 cases, and our mortality rate is at 1.9%. I'm sad again today to report that we've had an additional 11 deaths. 7 of these people are over the age of 65, and all of the people who are over the age of 65 had underlying health conditions. One person between the age of 18 and 40 passed away, and they too had underlying health conditions. 3 people between the ages of 41 and 65 passed away, and 2 of them had underlying health conditions. This brings the total number of deaths here in LA County to 89. And as I noted earlier, our mortality rate for COVID-19 stands at 1.9%. 78% of the people who have passed away from COVID-19 were over the age of 65. And the entire LA community mourns these losses, and we send thoughts and prayers to all the families and friends of people who have passed away. Today, we're also reporting an additional 521 new cases. Over the last 48 hours, there's been 1,055 new cases, and as I mentioned earlier, that brings our total to 4,566 cases, total cases, here across our entire county. This includes 153 cases that are reported by our partners in the city of Long Beach and 37 cases reported by the city of Pasadena. We're also reporting a total of 7 confirmed cases amongst people experiencing homelessness. Upon further investigation, 2 of the people that we reported yesterday were actually not persons experiencing homelessness. 77% of all of our positive cases are occurring between people who are between the ages of 18 and 65. This has been a fairly consistent number since the beginning of our outbreak. About slightly over 1,000 cases, 1,018 people have at some point been hospitalized while they've been positive for COVID-19. That's 22% of all of our positive cases. And again, this number has remained fairly constant. Of the 541 people that are currently hospitalized for COVID-19, 347 of these people are 55 and older, and 235 are over the age of 65. You can see an updated report on all of our LA County cases on the Department of Health's website, www.ph.lacounty.gov. I want to also continue to give information about our institutional investigations. So our number has jumped again. We are now investigating outbreaks at over 67 institutional settings. This means that there's at least 1 confirmed case of COVID-19 at these sites. These include nursing homes, assisted living facilities, shelters, treatment centers, supported living, jails, and prisons. The total confirmed cases in institutional settings is 321, including both staff and residents. 166 of these confirmed cases are among residents, and 155 are among staff. We're sad to report that 11 people have died from COVID-19 from these settings. All of the settings where we've had deaths are either in skilled nursing homes or assisted living facilities. This reflects an additional 4 deaths since yesterday. Across all of our correctional facilities, we have 25 cases, 18 that are amongst staff, and 7 amongst people who are incarcerated or otherwise detained. We do post a list of all of the facilities with confirmed cases on our website once they have had the opportunity to notify their staff, residents, and families. As a reminder, with the spread of COVID-19 across the county, we will continue to see more cases among staff and residents who are in our institutional settings. And while our DPH teams will work with the management and the staff at every single setting where there's a positive case, I hope that everyone understands that at all of these settings, the management and staff do their very best to protect the health and well-being of their residents and anybody who's living in their institutional settings. Many of the residents who are in institutions where we are investigating a case have appropriately been quarantined if they were exposed. As of April 1st, almost 26,000 people in LA County have been tested. About 13 to 14% of them are positive, but again, we still have 2 large commercial labs that are not reporting their negative lab results to us. So I think that the percent of people who are actually positive will end up going down slightly. Every day we've seen huge improvements in testing capacity, and this is truly a testament to the work of Dr. Kazan. And I've appreciated, as I know all of you have, our ability to actually offer more testing everywhere throughout the county. But as a reminder, the capacity is still limited, and sometimes it's still taking a very long time for people to get their results. So it remains critically important that we prioritize testing for people who are symptomatic at this point and have a clinical provider that has asked that they be tested for COVID-19. For everyone else, if you're not experiencing symptoms, please stay home. And remember, if you are going out for essential services, you need to practice all of the physical distancing measures that we ask, staying away from people at least 6 feet at all times. I do want to take a minute to just talk about what we know and what we're expecting over the next few weeks. I try to share and continue to share all of the information that we have when we know it. And I want to give you as much information as I can about what this all might mean for us. What has happened so far is pretty much what we expected here in LA County. As I mentioned a few weeks ago, once we were increasing our lab capacity, we would see a corresponding increase in the number of people that were positive, and that happened. At the initial increase in lab testing a couple of weeks ago, I reported that we were tripling the number of cases here in LA County over very short periods of time, between 3 and 4 days. The last 2 weeks, we've really seen more of a doubling of cases every 6 days, and that is good news. I think as we increase capacity, however, we need to be really prepared for the fact that that is going to result in increased number of people who are testing positive. So if we assume that we're getting to where we're striving to be, which is that we're able to do test 10,000 people a day, and about 10% of the people we test continue to be positive, you can see why we need to prepare ourselves for having 1,000 new cases of people with COVID-19 every day. And we want to be prepared for that. I think it's very accurate that at some point next week we will start reporting that big an increase in the number of cases because thankfully we're able to actually test more people and make sure that people who are tested have the opportunity, if they're positive, to isolate themselves and not infect others and identify their close contacts who will quarantine themselves and also not potentially infect others. So this is what it means for all of us here in LA County. The next few weeks are going to be critically important because we are going to see more cases of people who are positive with COVID-19. But it's our hope that the rate increase continues to be manageable and that we don't overwhelm our healthcare system. And I think that, in part, depends on all of you. If we continue to do everything we can to practice physical distancing, keeping 6 feet away, we stay home as much as possible, we wash our hands at every single opportunity, and we don't unnecessarily overwhelm our healthcare system unless we really need to either see a provider because we're ill or we need to go to a hospital because we're seriously ill. We can continue together to manage the road ahead. But as we embark on these days that are coming, we must continue to strive to keep ourselves apart. I particularly want to put a plea out to our grocery stores who are doing an amazing job making sure we have access to food and supplies, and our pharmacies. It is critically important, as there are more cases of COVID-19 in our community, that those who are most at risk for serious illness, and that includes primarily people who are older and people with underlying health conditions and pregnant women, that they can stay home all of the time. If there's any possibility that you can offer free delivery to people who are at higher risk so that they can avoid entirely going into stores to get their essential goods, it would be best as we see more and more cases amongst our residents. And I'm going to close with just a reminder around masking. As I said yesterday, we have really two kinds of masks. We have medical masks that are for healthcare professionals and frontline workers who interact with the public, particularly with the public who may be sick. And then we have what we call homemade face coverings. For everyone who's an essential worker working in healthcare or working with people who are ill, we need to make sure that they have the protection they need to do their best jobs. And that means they need to have access to all of the N95s and all of the surgical masks that are in our depleting stocks. For everybody else, particularly the public, it is perfectly appropriate for you to think as you go out to do your essential purchases that it is best, in order for you to protect others, because you're not really protecting yourself, for you to put on a face covering. And that face covering should be something you make yourself. It should definitely not be a medical mask. Appropriately has to be laundered every day so that it's clean. But it is a good idea for people who are asymptomatic and want to protect others and feel like they may be in contact with other people as they do their essential purchases to put on that homemade face covering. But it is not a substitute for our main tools, which are physical distancing, staying home, particularly if you're ill, and hand washing. Those are the main ways we're going to continue to prevent transmission, and I ask that if you're using a face covering, please don't stop doing what we know works best. Keep your physical distance from others, stay home, particularly if you're ill, and wash your hands frequently. With that, I'd like to introduce Dr. Christina Galli from the Department of Health Services.
Hi, I'm Dr. Christina Galli, the Director of the Department of Health Services for Los Angeles County. Good afternoon, and thanks for joining. I want to offer always my sincere thanks to all the people on the front line and all of the healthcare workers out there who are working so hard, both for the patients that are currently in the hospital as well as the increased volume that might come. You're really inspiring with your courage and your dedication to the mission of healthcare work. We continue to see high levels of partnership across multiple sectors that affect healthcare. I'm grateful for all the work of people across supply chain, emergency medical services, hospitals, clinics, all of the different pieces that are really working together to be able to increase the bed volume for potential surge in patients. I'll provide just a brief overview, a snapshot of current bed capacity, and I'm happy to answer questions later if there are any. As of today, across all of the hospitals in the county, there are currently 1,627 open beds. About 1/3 of those open beds are located in the 4 county hospitals. This includes, across the entire county, about 286 open intensive care unit beds. The system has the capacity to treat COVID-positive patients as well as others who might have a need for hospital level of care. We continue to work on bed modeling and the demand for services in the future. As Dr. Ferrer has mentioned, we are getting increasing results on testing and turning around the test results more rapidly. This will help feed into those bed models, and we'll be able to share additional detail and information on this in the days and weeks to come. What's important, though, still for the public to understand is that all of those models really show the critical importance of physical distancing measures, also the critical distance of respecting quarantine and isolation orders if you have been directed to to quarantine yourself or isolate yourself by the guidance of public health or your own personal provider. Please take these directives seriously. Please maintain that 6 feet of social distance and physical distance between yourselves and others when you go out. And please try as much as possible to be at home. It is very seriously safer to be at home, and we all have a responsibility to do that as much as possible if we aren't required to go out for essential purchases or because of the nature of our work. All of the hospitals across the county have the ability to add surge capacity, and they are actively doing so. This includes freeing up beds. As I've mentioned, that's where we get the 1,627 beds that are open today. Hospitals are also in the works of adding new capacity. The governor has set a goal for all hospitals to be able to increase or surge their capacity above their typical staffed rates of about 40%. In DHS, we are aiming to be able to surge 50% above our licensed bed capacity and are actively working to make room for those additional beds and provide the staffing and supplies that are needed to run them. On top of this surge capacity within hospitals, the county is working in partnership with the state to establish a number of alternative care sites that would be able to offer both acute level hospital services as well as various levels of lower level of care. The Emergency Medical Services Agency is focused right now on establishing transfer protocols and coordinating transfers between these alternative care sites when interfacility transfers are needed. They continue to distribute personal protective equipment to healthcare providers across the county. To date, over 4.5 million units of personal protective equipment have been distributed to providers across the county, and they continue to work in partnership with the state to be able to service out-of-service ventilators. About 170 of those have been serviced to date, and the state and county are working together to service an additional 150 or so ventilators. This is on top of the 850 unused ventilators that are already on stock within public and private hospitals across the county. In closing, I just want to thank all the hospitals and healthcare providers for their hard work and thank the general public for your part in helping to limit the spread of COVID so that we can preserve the strength of the hospital system for those who need it. With that, I'll turn it over to Antonia Jimenez, the Director of the Department of Public and Social Services. Thank you.
Good afternoon. My name is Antonia Jimenez. I'm with the Department of Public Social Services. It has been about 2 weeks since the department closed its doors to help slow down the spread of the coronavirus. But we know that in this time of crisis, individuals and families need our services more than ever. It is our job to support our county's individuals and families throughout this crisis. And while our offices are temporarily closed, I want to assure all county residents that DPSS is open for business and ready to serve you. I want to clarify that you do not need to personally visit any of our offices in order to apply for benefits. You can go into our portal, web portal, or call our call center. For existing customers, we have some good news in that you do not have to submit any reporting documentation, no QR7s, no SAR7s, no annual recertification, and you will continue to get the benefits for March, April, and May 2020 without you having to do anything. You don't have to call our offices to confirm. This will be automatically, these funds will be automatically put into your EBT card. However, if you receive Medi-Cal, your benefits will also continue for March, April, and May. However, it's important that you comply with the renewal reporting requirements for Medi-Cal. Otherwise, once the suspension is lifted for Medi-Cal, your Medi-Cal will be terminated. So we want to be able to receive the Medi-Cal packages, renewal packages, and we want you to send them either by mail or through our website. For existing customers, we have a new benefit that's coming out just in light of this coronavirus, and the state is going to be authorizing what's called emergency benefit allotment. And what that will do is any household that currently does not receive the maximum allowable amount for their household size will receive an increase in their EBT card automatically. You don't have to apply, you don't have to do anything. So I'll give you an example. A single adult can receive a maximum benefit of $194. If they currently are only receiving $140, they will get an additional $54 added into their EBT card. If you're a family of four, you were able to get a maximum of $646. If you're currently receiving only $500, you will get an increase in your EBT card of $146. So as a point in reference, the maximum number family of 6 is $921. So in LA County, we will be issuing $57.5 million to 366,000 households in LA. These allotments will come in two installments. The first installment will be for the March month, and that will show up on your EBT card on April 12th. For the April installment, it'll show up in your EBT card on May 10th. However, if you are already receiving the CalFresh maximum amount for your household, you will not be receiving any additional dollars. During this time period, we know we're here to serve you. We've received an increase of CalFresh applications by 38%, an increase of CalWorks applications by 32%, 3% for Medi-Cal, and 6.5% for our general relief population, which is our single adults. And now I just want to touch a little bit on our in-home supportive services. So the reassessments for the in-home supportive services have been suspended for 90 days. In lieu of that, our social workers are contacting the consumer and doing an assessment via phone and also checking on the individual's welfare. So they're doing welfare checks over the phone to make sure that our IHS consumers are safe in their home. DPSS is aware of the financial impact that the coronavirus is having on the health and financial well-being of the County of Los Angeles residents, leaving thousands of unemployed or underemployed. We know that the demand for our services will greatly be increased. So I encourage you to go visit our website at dpss.lacounty.gov to get more information about the various programs that we are offering to everyone. And also, please watch our social media accounts so that you can get updates on changes that the government is putting on. Just like we just did the emergency allotment, there will be other changes that are coming, and we want to be able to share those with you as well. Please help share this information that with someone in your community, with people who need it the most. And finally, I just want to say how proud I am of the DPSS workforce as you work hard to provide hope for many of the individuals and families in LA County. So thank you very much. Stay safe and be well. And now, Ryan, I'll turn it over to you for questions. Thank you very much.
You'll hear an acknowledgement that you've been placed in queue. If you'd like to remove yourself from the queue, press 10 again. Our first question will come from the line of Jim Roop. Please state your media outlet, and then your question.
Jim Roop with Westwood One News. Governor Gavin Newsom, by the way, good afternoon. Governor Gavin Newsom today outlined a first-in-the-nation deal with FEMA to pay for 75% of the cost of the leasing of these hotel or motel rooms or the purchasing of them for the purpose of quarantining and isolating the homeless population who are tested positive or who are vulnerable, like the elderly. But he says that the counties really drive this car. So I guess, Supervisor, this is really for you. How is that mechanism working? Are there teams out there assessing the situation? Are you expecting the homeless to come to you? I don't think that's going to work. How exactly are they being found, and then what's the process for this to happen?
So thank you for that question, and that's why in my remarks I acknowledge the work not only of our first responders and those in the front line, but our county workers and nonprofits that are going out on a day in and day out basis helping those that are currently in need, and that includes the homeless. And we've had a great partnership with the state putting together these hotels and motels, and they are county-wide. They're in areas where we know there's a large homeless population. LA City's ground zero for sure. So we've got contracts here in LA City, but we are throughout the county, in the East San Gabriel Valley, as well as the Antelope Valley, Santa Clarita, San Fernando, and South Bay. And so we have worked very well on that, and the governor did a tremendous job leading and pushing that forward. The outreach teams are going out, and we are encouraging those individuals to get in off the street and are making it as effortless as possible for them. And we continue to do that on a day in and day out basis. And with these hotel and motels, especially for those that are quarantined, we're not just looking at the ones that are going to be quarantined. We're also looking at those that are on the street that are more vulnerable while on the street to contracting the coronavirus. So we are going to continue to be aggressively pursuing that. But I really have to point out that the social workers that are going out there each and every day are going out to do outreach to really to help the most vulnerable on the street right now. Next question.
Thank you very much.
That question comes from the line of Rob Hayes. Please state your media outlet and your question.
Good afternoon. It's Rob Hayes with ABC7 News. Two questions for Dr. Ferrer. The first one, why has the state fallen so far behind in COVID testing? Our data shows California is ranked 50th, dead last in testing numbers.
Thanks for the question, and appreciate the concern, and I know that it's shared across a large number of the folks who live here in LA County. I think we were behind. You know, those numbers lag a little bit. I think we've actually pretty significantly increased capacity, certainly here at the county. You know, you've all been with me for a while, so you know our capacity at the very beginning of this was, you know, we were well under 50 tests a day when we started. We thought we were doing well when we were able to get capacity up to 200 or 300 tests a day. And now we're actually testing over 7,000 people a day across the county. And those numbers all have a lag time. When I report to you our numbers, and this is so good that you're bringing this up, I'm reporting the day on the results. And so actually, that's the lag time. We've actually probably are testing close to 10,000 people a day here in LA County now, but the slowdown is when we get the results. That's when I actually can say to you, here's how many tests were done, here are the number of people that were positive. So I want to say that enormous progress has been made, but I think when you look at where we stand nationally, we have been disadvantaged. And I would say in part, we've been disadvantaged by some of the inability for some of our most, local partners to be able to process quickly their FDA approvals. So we've got some businesses here that are local to us that would love to do more lab testing, but they're still in the process of getting expedited FDA approvals. You know, I'm looking forward to seeing huge improvements here in the county. And we'll take the next.
And a quick, I'm sorry.
Yep, go ahead.
A quick follow-up question as well. We're seeing people selling masks on street corners. There was one guy selling them for $5 a piece. He reaches into cars, hands them off. Is something like this safe? You know, are the masks that are being made like this safe? And is $5 a mask, is that price gouging?
So, you know, it really, hopefully what they're not trying to sell are surgical masks or N95 masks, which, as I've noted, please, these need to be reserved for healthcare workers and first responders. If folks are selling homemade masks, you could feel free to purchase those. They ought to be washable, though. I mean, if you're purchasing ones from a vendor, please make sure you can wash them, that you should be washing them every day. That's the best way to use them and the safest way to use them. And I'm not sure what price gouging would look like because it depends on what materials somebody has used to make this homemade face covering. I will say you can make one fairly inexpensively at your home, and there's a lot of guidance online about how to do that with materials that all of us have in our houses. So if you don't want to pay for them, you don't need to. It's probably easiest and best to just make one at home that you can launder safely every day in your house. But thanks for your questions. Next question.
Great, thank you.
Go ahead.
It was a question for Dave Lopez. I didn't hear it.
Yeah. Yeah. Hi, Dave.
Yeah. Yes. Hi. I'm sorry. Sorry, I didn't hear it. Doctor, there was a statistic that came out just today that shows people are literally drowning their sorrows in this. Liquor sales way up over 60%, wine sales up over 40%. Was that something to be expected, and could that result in more troubles than what you can cope with now? And a real quick question for the supervisor. Supervisor, can you comment about the report that the county is spending $400,000 for a PR firm?
Yeah, I appreciate the question on the liquor sales. One thing I want to note is it's not really clear to us that consumption is actually up, because remember, we all were able to go to bars and restaurants where we dined in and had a lot of access to alcohol was actually through drinking that might have happened in places that are now closed. But I do want to remind folks, it is very easy to get overwhelmed. It's very easy to be depressed and anxious with the state that we're all living in, and particularly for those people who may be struggling with an addiction. This is a really hard time, and I urge you to reach out and ask for help. Please don't stay home feeling depressed and anxious and not reaching out for help. If you have a provider, use the provider. The Department of Mental Health has a 24-hour 7 line for you for just this purpose. Because while recreational use of alcohol, moderate use of alcohol, may in fact be for some people appropriate, for others it's not, and other people may need to reach out to find better ways to cope with anxiety and depression. But I'll put the supervisor back on for the second part of your question.
Thank you for that question, Dave. I'm glad to have the opportunity to address it. It's 2 contracts, and these were done when the coronavirus was starting to heat up. The board was meeting each and every week, getting a brief update from Dr. Ferrer regarding coronavirus, and we realized we needed to get out the word quickly to the 10 million residents. So we had 2 firms hired. One actually was already being used by the Department of Public Health for public service announcements for meth use and other things that they've been using them for. So we brought on another firm in order to get the word out, to do things like Safer at Home, to make sure that we are properly getting the message across to our constituents about the importance of abiding by the public health recommendations. And so, it's unfortunate that that's now become a political issue for some, but this was done with the intent of truly protecting the 10 million residents, and we had to do it within a period of less than 1 month. Actually, we did it in 2 weeks, and I actually thank these firms for helping us, because there's no question in my mind when I hear each and every day the numbers, albeit when I hear the number of deaths, each death is heartbreaking, but I realize that by doing what this board did to get out in front, we may have very well saved lives and kept those numbers down. So I appreciate the question. Next question.
Okay, thank you.
Our next question will come from the line of Steve Gregory. One moment, please. All right, Mr. Gregory, please state your media outlet and your question.
Thank you very much. Good afternoon. Steve Gregory, KFI News. Dr. Ferrer, a week or so ago, I asked a question about aerosolization of the virus, and you told me that the virus itself is not aerosolized in very unique circumstances, maybe intubation or extubation. But now we're seeing all these reports coming out from legitimate organizations talking about bioaerosols, microdroplets, and people are starting to kind of feedback we're getting, people are really worried about like walking next to somebody and walking in the same distance as somebody, thinking that the virus is hanging in the air for hours. Can you revisit that? Also, can you talk a little about the potency of the viral load? Is like a microdroplet or a small droplet on somebody, is that going to have the same deadly consequences as someone getting a full sneeze, for instance? And also to Madam Chair Barger, have all of the members of the board been tested? Thank you.
Thanks so much. And you know, I always appreciate the questions on, you know, is this virus airborne? Is it like measles? Because one thing we know for sure, it's not. You know, there's so little certainty that we can actually talk about because it's a new virus. But we do know for sure this is not an airborne virus. It does not hang out in the air for hours, similar to what measles can do. It's a much bigger, we can't see it, but it's still a bigger droplet, and it actually falls to surfaces, the ground or a table or some other surface, very quickly because of its size. So I do want to remind everyone that is one thing we know. I think the more important question for us to really grapple with is probably your second question, which is, you know, what is this viral load issue, and you know, what does it take for me to actually come down with COVID-19 if I do have an exposure? And does it matter how much of an exposure I have? You know, there is some new research that's been coming out that actually has been trying to get us answers to this. One thing that seems pretty clear is that how much of the virus you get may in fact affect how sick you get. So it's not so clear yet whether or not that has an impact on whether you get infected as much. But it does seem pretty clear that the more exposures you have to the virus, the more viral load that enters into your body, the more likely you are to experience serious illness. And some of these studies have been done among healthcare workers who, and I'm so glad Dr. Galley thanked them all, who, as you know, are at extraordinarily high risk because of the work that they're doing for having multiple exposures to the virus. But that also is the question that people are looking at. For example, an asymptomatic person, are they likely, even if they expose some of us because through their breathing droplets, what is that exposure likely to do to us? And it's also pretty clear that if someone coughs in your face and they're infected, and you've got that direct sort of exposure to a lot of potentially virus, it's probably easier for you to get sick in the first place than just as you said, like I just happened to be talking to someone for 1 minute and there were some droplets that sort of, you know, floated on my hand, then I put my hand on my mouth and now I'm going to get infected. That's probably not as what I call efficient route, not as efficient a route for getting infected. But I'll turn it over to the supervisor now.
So obviously I can't speak for my colleagues, but I can tell you that I have not been tested, nor do I feel a need to be tested. I know the kits are in demand, and so I'm listening to our Director of Public Health, who I believe has wise advice in terms of the fact that if you feel okay and you haven't displayed any symptoms, you don't need to be tested. So I can't speak for my colleagues, but no, I have not been tested. And we're going to do one more question. Thank you. One more question.
That question will come from the line of Lee Ross. Please state your media outlet and your question.
Thank you. Lee Ross with Fox News. Dr. Galley, the Mercy has two questions on the Mercy, if I can, which has been in port now for 1 week, and as of a couple of hours ago, has 17 patients on board, which seems, and you can correct me on this, it seems like a staggeringly small number. I'd be obliged for your assessment on why the ship has so few patients. Is there a problem perhaps with getting patients on board, or in the alternative, has there been a lack of need by hospitals in LA County to move people there? And then my second question on the Mercy is, we've learned that the Defense Secretary is re-examining the mission of the Mercy to perhaps accept patients who are COVID-19 positive. What pros or cons can you offer about whether such a change in mission should take place? Thank you.
Hi, thanks for the question. You're correct that there are currently a small number of patients on the Mercy. The EMS agency has conducted, they did a webinar yesterday with all of the hospitals across the county to make sure they're aware of the protocols for who's eligible for transfer to the Mercy and how that transfer process would take place. The current guidelines, which you make reference to, is the fact that all patients transferred to the Mercy need to be documented as being negative for COVID. They need a test that is negative within 72 hours prior to transfer. So hospitals are in the process of identifying patients suitable for transfer, and we're going through those transfer protocols. Currently, several hospitals, both public and private, have already transferred patients to the Mercy. I do think it is important to note, though, that yes, the reason why the number of patients transferred at this point is small is because hospitals currently have available beds. We are absolutely knowledgeable that we need to have the surge capacity available in the case of an increase in number of patients that need hospitalization, and we're so grateful for the Navy for providing that resource to Los Angeles County as well as neighboring counties, but we also want to be judicious with it. With respect to whether or not the policy would change to accept COVID-positive patients, I would defer an answer to that to the Defense Department and what they feel like would be the best use of that ship. I think either way, COVID positive or COVID negative, even if it remains COVID negative, it still serves its purpose of providing surge capacity for hospitals. Hospitals have plenty of patients that are COVID negative that they could offload to the ship in the case of a COVID surge, and so it still serves that fundamental purpose either way.
Thank you, Dr. Gelling. Now we are going to have remarks in Spanish. Thank you.
Buenas tardes. Soy Hilda Solis, supervisora del Condado de Los Ángeles, representando el primer distrito. Hoy quiero dar las gracias a todos por sus esfuerzos en esta lucha contra el virus. La semana pasada, más de 878,000 personas en California solicitarán beneficios de desempleo. Creemos que ese número se traduce en aproximadamente 250,000 residentes en el condado de Los Ángeles que solicitarán beneficios de desempleo la semana pasada. Si ha perdido su trabajo o si sus horas de trabajo se han sido reducidos por este virus, pueden recibir beneficios de desempleo. Por favor, llama 8003-268937. La ley CARES, el paquete financiero de $2 billones que fue aprobado por el Congreso, ayudará a millones de personas con un cheque. Personas que reciben beneficios de seguro social también recibirán apoyo financiero igual. Para obtener más información sobre estos cheques, llamen a sus miembros del Congreso. También ayer el gobernador Newsom anunció que el condado de Los Ángeles va a recibir fondos estatales para ayudar a nuestros trabajadores y pequeños negocios. El condado de Los Ángeles recibirá $500,000 en becas para asistir pequeños negocios que han sido impactados por el coronavirus. Estos fondos serán usados para ayudar pequeños negocios a retener sus empleos y para mantener sus negocios. Estamos trabajando para lanzar este programa lo más antes posible. También estoy orgullosa que el condado ha lanzado el Centro de Asistencia de Emergencias para Negocios y Empleados por un portal central con recursos para nuestros trabajadores y pequeños negocios. El Centro de Asistencia tiene personas que hablan español y listos para ayudar a ustedes. Para contactar el Centro de Asistencia de Emergencias para Negocios y Empleados, por favor llamen 833-23-84450. Entendemos que el acceso a las comidas en particular es difícil para unas familias de bajo ingreso y personas de tercera edad. Para información sobre el programa de nutrición diseñado para personas de la tercera edad, llamen a 1-800-510-2020. Y para estudiantes que normalmente van a participar en programas de almuerzo en sus escuelas, pueden llamar también a 211 para conseguir y luchar también para las comidas para sus familias. En conclusión, a pesar de estos tiempos difíciles para nosotros, el condado está a su lado, peleando para sus derechos. Pueden salir a caminar o comprar comida, pero cuando lo hagan, es importante que se mantengan una distancia de 6 pies de los demás y también que cubran la cara. Muchas personas están haciendo mascarillas de tela hechas en la casa. Hay muchos videos en el internet que demuestran cómo hacer máscaras con materiales encontrados en sus casas. Tienen que practicar la distancia social porque sí funciona. Pero solo funcionando todos bien podemos a mejorar las condiciones de nuestra comunidad. Durante estos tiempos necesitamos reunirnos y hacer nuestra parte de la solución. Muchas gracias y hoy me da gracias a introducir la doctora Barger Ferrer del Departamento de Salud Pública.
Muchas gracias, Supervisora Solis, y muchas gracias a la Supervisora Barger y a todos nuestros colegas por su liderazgo. Quiero comenzar hoy con las estadísticas mundiales. A nivel mundial hay más de 1 millón de casos en este momento y la tasa de mortalidad es del 5%. Aquí en los Estados Unidos tenemos 245,000 personas que son infectadas con el COVID-19. Aproximadamente 1/4 de todos los casos globales están aquí en los Estados Unidos. La tasa de mortalidad en los Estados Unidos es del 2.5%. En California tenemos más de 10,000 casos y la tasa de mortalidad es del 2.3%. Pero aquí en el condado de Los Ángeles estamos reportando hoy 4,566 casos. Nuestra tasa de mortalidad es 1.9%. Estamos tristes hoy de reportar las 11 muertes adicionales hoy. 7 de estas personas tienen más de 65 años y todas las personas mayores de 65 años o más tienen afecciones delicadas de salud. Esto eleva el número total de muertes a 89 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para el COVID-19 es el 1.9%. La comunidad del condado de Los Ángeles lamentamos estas pérdidas y enviamos nuestros pensamientos y oraciones a las familias y a los amigos de las personas que fallecieron. Lamentamos mucho su pérdida. Hoy también estamos reportando 521 casos nuevos. Y quiero señalarles a todos que por favor, si quieren más información sobre los casos, pueden ir a nuestro website, que es el Public Health LAcounty.gov, gobierno, gov. Te puedo dar un poco de información sobre el dato de las hospitalizaciones. Ahora tenemos 1,018 casos que han sido en algún momento hospitalizados. El 22% de todos los casos positivos. 15% de las personas que ahora en este momento están hospitalizados se encuentran en la unidad de cuidados intensivos. Y muchas de esas gentes tenían condiciones de salud delicadas. También estamos reportando sobre casos de entornos institucionales. Actualmente estamos investigando a 67 entornos institucionales con al menos un caso confirmado de COVID-19. Estas instituciones incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo, cárceles y prisiones. El total de casos confirmados en entornos institucionales es 321, y esto incluye tanto el personal como los residentes. 166 de estos casos confirmados son residentes y 155 son empleados. En todas las institucionales correccionales en el condado tenemos 25 casos, 18 entre el personal y 7 entre los reclusos. Como recordarle a todos, con la propagación del COVID-19 que está en todo el condado, es bien importante que todos nosotros cogemos todos los recuestos para que podemos quedarnos con la distancia social. Nuestros equipos en el DPH, Departamento de Salud Público, estamos trabajando actualmente con todas las instalaciones que tienen casos positivos, y la gerencia y el personal en todas estas instituciones están haciendo todo lo posible para proteger la salud de sus residentes. Muchos de los residentes en estas institucionales están debidamente en cuarentena si han sido expuestos. Voy a terminar con un poco de información sobre las pruebas. Hasta el 1 de abril, casi 26,000 personas se habían sometido a pruebas en el condado de Los Ángeles, y casi 13% de estas personas dieron positivos. Todos los días vemos grandes mejoras en la capacidad de las pruebas, y esto es un testimonio del trabajo del doctor Kazan en el Departamento de Bomberos. Pero la capacidad sigue siendo limitada y a veces lleva mucho tiempo para obtener resultados de las pruebas. Sigue siendo crucial priorizar a ciertas personas para las pruebas, aquellas con síntomas y que un proveedor ha determinado que son apropiados para las pruebas. Para hacerle la prueba aún debe estar al orden de un médico para que te puedan sacar la prueba. Para todos los demás que no tenemos síntomas, tenemos que quedarnos en la casa, y si tenemos que salir para servicios esenciales, tenemos que practicar medidas de distanciamiento social. Manténganse a 6 pies de todas las demás personas en todo momento. Muchas gracias a todos por la fuerza y por participando en todos los métodos de distanciamiento social. Y ahora ahora viene a hablar Antonia Jimenez, la directora del Departamento de Servicios Sociales.
Buenas tardes, mi nombre es Antonia Jimenez, soy la directora de Servicio Social para el Condado de Los Ángeles. Han pasado 2 semanas desde que el departamento cerró las puertas al público para ayudar a frenar la propagación del coronavirus. Pero sabemos que en el tiempo de crisis, personas individuales y familias necesitan nuestro servicio más que nunca. En nuestro trabajo, apoyar a las personas individuales y familias de nuestro condado es muy importante, especialmente durante esta crisis. Mientras nuestras oficinas están cerradas temporalmente, quiero asegurarle a todos los residentes del condado que el departamento está abierto y listo para servirles. Quiero aclarar que no necesitan visitar personalmente ninguna de nuestras oficinas para solicitar o renovar sus beneficios. Si usted recibe CalFresh, CalWorks, ayuda general, asistencia monetaria para inmigrantes, sus beneficios continuarán con la misma cantidad en marzo, abril y mayo del 2020. no tiene que presentar ningún SAR-7, ningún paquete de recertificación o cualquier otra documentación que naturalmente se requiere durante estos programas. Y no es necesario llamar a nuestra oficina. Su dinero será continuado y puesto en su EBT card sin que tengan que hacer nada. Ahora, si ustedes reciben Medi-Cal, sus beneficios también continuarán para el mes de marzo, abril y mayo, pero más sin embargo es importante que usted cumpla con el requisito de reportar la renovación para Medi-Cal o sus beneficios serán terminados después de 90 días. Si ha recibido su paquete de renovación, le pedimos que por favor lo envíe por correo o súbelo a nuestro sitio web. Si usted recibe CalFresh, vamos a tener una asignación de emergencia que será automáticamente agregada a su EBT card. Esta asignación aumentará sus beneficios de CalFresh a la cantidad máxima de beneficios para los miembros elegibles de hogar hasta su máximo de 6 personas. Por ejemplo, si alguien está recibiendo si una persona recibe 140 por mes, se le incrementará en $54 para recibir un beneficio de 194. 363,000 personas van a recibir $57.5 millones durante ese aumento. Le aseguramos la asignación de marzo va a estar en su tarjeta, en su EBT card, en abril 12, y la asignación de abril va a estar en su tarjeta en mayo 10. Si usted recibe servicios para apoyar nuestras IHHs, nuestros ancianos y personas con deshabilitadas, nuestra revelación de este programa de servicios serán suspendidos por 90 días. Sin embargo, nuestros trabajadores sociales continuarán comunicándose con clientes para llevar a cabo evaluaciones y realizar comprobaciones de su bienestar por teléfono. El departamento tiene muy presente el impacto financiero que el coronavirus tiene sobre la salud y el bienestar financiero de los residentes del condado de Los Ángeles, dejando a miles de desempleados. Sabemos que la demanda de nuestros servicios aumentará considerablemente. Una vez más, les recomiendo ir a nuestro sitio web en www.dpss.lacounty.gov para obtener información sobre cómo solicitar todos nuestros servicios y otros recursos financieros útiles. Nuestra página de redes sociales se actualizarán diariamente, así que por favor síganos para que vea los anuncios que están más recientes. Por favor, ayuden a compartir esta información muy importante con la gente de su comunidad. Cuídense y manténganse en salud. Muchas gracias. Esto terminará la conferencia de prensa. Hasta mañana. Muchas gracias. Bye bye. This will end our press conference for today. Thank you very much.